Assalamualaikum and good evening to Dr. Toiba and everyone. Today, me and my team members would like to present about our case study too. Firstly, I wanted to introduce my group members. From the left is Nurul Izzah binti Hanafiah. Second, myself, Izib Nakudin bin Izzuddin. Next, Aidil Denan bin Azman. And last but not least is Cik Shazlan bin Cik Azmi. Okay, for the first part is name of component. Shrink are an important component of hospital and clinic device, and they play a vital part in medical and treatment procedures. There are various types of shrink in use, with hypodermic and oral shrink being the most common. Because of the incorrect manner of use and the design itself, shrink can sometimes result in cross-infection and needle stick injuries. In typical practice, there are two major issues with shrink. The first is shrink reuse, and the second is needle stick and sharp injuries. The second part is strategy to perform a material selection for the shrink. First, polymer is the main substance in shrink. Polymer is the main substance in shrink because the most common polymer used in industries are polypropylene and polyethylene. Second is polypropylene was used as the raw material for the shrink body. It's critical to research the quality of the material that will be used in this investigation. The shrink is made primarily of the polypropylene as previously stated. Last, two types of polypropylene materials. Two types of polypropylene materials such as copolymer and homopolymer. In order to choose the appropriate material, the real process of industry should be studied.
Assalamualaikum, my name is Nurul Izzah binti Hanafiah. I'm from BMFB, B0520100135. So I'm going to present about process parameter. So for process parameter, we have two parts, which is barrel and plunger. For barrel parameter, it is translucent, smooth surface, non-porous surface, biodegradable, high strength, high hardness, and non-porous. For plunger, smooth surface, non-porous surface, biodegradable, high strength and high hardness, and non-porous. So in this slide, it shows the process of medical syringe being produced. First, we start with material selection and then process selection. Move on with injection molding. After that, we do part making. Next, assembly machine of shrink, and then we follow with pad printing. After that, packing machine, and lastly, sterilization chamber. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Cik Shazlan bin Cik Azmi, and my metric number is B0520100092. Okay, today I'm going to be doing a presentation about the testing and quality control for a shrink. Quality control involves testing units and determining if they are within the specification for the final product, which is shrink. The purpose of testing is to determine any needs for corrective action in the manufacturing process, while quality control is a process through which a business seeks to ensure that product quality is maintained or improved. Okay, for the testing shrink prior to filling present a few challenges that largely relate to the fact that only one part of the combination product, which is sterile barrel, is being tested. Example of the testing is we have glide force testing to evaluate shrink lubrication, pull off force testing of the tip cap or the needle, flange brake resistance testing, lower cone breakage resistance testing, needle pull off force testing, lower lock adapter collar pull off force testing, lower lock adapter collar torque resistance testing, and lower lock rigid tip cap in-screwing torque testing. For the quality control, given that so many different tests must be conducted on the shrinks, it is not surprising that there are many opportunities for this complex system to fail to meet the quality requirements. Cosmetic defects such as scratches are common. This unit are rejected because it can be difficult to determine if a scratch is only at the surface of the material or if it is cracked. I mean fully cracked. Okay, for needle shrink, insufficient needle pull-off force can occur due to weak needle assembly and imperfect adhesive polymerization control. For field shrink, failure depend on the drug design, on the drug product design, the shrink process design, and the careful assessment of interplays. High injection force, long injection times, and general issues with gripping the shrink are the example of the quality control. That's all from me. Thank you so much. For this session, we are going to discuss about the effect of parameters on the performance of the product, which is shrink. Parameter is a numerical or other measurable factor forming one of a set that defines a system or set of the condition of its operation. The important parameters when specifying needles are needle gauge, length, inner diameter, and outer diameter. When specifying a needle, they range from the largest to the smallest. The largest needle gauge, the smaller the needle. Depending on the capacity of a shrink, its primary measurement line marking may be in millimeters, such as 1 millimeter, 2 millimeter, and 5 milliliter, or fraction of a millimeter, such as 0.1 milliliter, 0.2 and 0.5 milliliter. The larger the capacity of a shrink, the more space there will be in between the measurement line. Okay, the accuracy of the parameter on the shrink is the main reason in influencing the performance of a shrink. Perfect parameter give the best performance for the shrink to be used. For instance, to evaluate product viscosity, density, and aeration on the dose delivery and accuracy for interval injection with commonly used commercial available hypodermic in 1 milliliter shrinks. Okay, conclusion, formulation parameters like viscosity can have an impact on dose delivery using hypodermic shrinks for intravitreal injections and on the resulting glide force. Thank you so much.
Hi and Assalamualaikum. My name is Aidil Daniel bin Azman. I would like to give a few examples for the type of defect and countermeasure. Firstly is a molding defect. Injection molding is the most widely used manufacturing process for producing plastic parts, and it is used to make a wide range of products that vary greatly in size, complexity, and applications such as a shrink. Some of the molding defects that can occur in a part during injection molding include flow line, seam marks, and vacuum void. Secondly is a defective print that shows scale number of the shrink. It is a pad printing, also known as typography, and the function for the pad printing is to print number and graduation marks on the side of the shrink bracket. And lastly is the shrink plugger stopper. The plunger, also known as the piston, is a component of the pre-filled shrink that when we press and push the vaccine containing liquid out through the needle and into the patient, the stopper at the plunger end must move smoothly in the barrel while preventing leakage or contamination. This table shows a few examples for the countermeasure. First is insufficient filling. So we need to include the resin amount, injection pressure, injection speed, and also the cylinder temperature. Second is insufficient strength of weld. We need to change the gate position so that welds are generated at location carrying a low load. Also, we need to increase the injection speed and both cylinder temperature. Third is for the seam mark. We need to increase the back pressure and the injection pressure. And we need enlarge the both cylinder and mold temperature. Lastly, for the defective print, we need to double check that the printing is in the correct location. So in conclusion, for this project has met its goal of designing and fabricating a safety shrink with a simple and non-complex design. From the material selection, we have decided to choose polymer as the material for the shrink.
Polymer is the best choice and it is the closest fit for the requirement of strength and cost. Last but not least, polymer is proven as the best material selection for safety string production.